Dr. Manoj Khatri. Manoj will be speaking on tips to peel diabetic vitreoretinal membranes.
Good morning, everyone, and thanks to the organizers for the kind invitation. There is a slight overlap in my and dear friend Unni's talk. So, just this is the area where we all struggle is identifying the planes, especially when you are doing a diabetic wits. So, a couple of challenging situations which we normally, when you have trainees along with you, they keep asking questions where you start the peeling, how you're going to start the peeling, and how to identify the membranes properly and give good visual and anatomical result to our patients. So these are a couple of tricks. The first tip tell them is have a good control over your cutting and suction. So the foot switch control is of paramount importance. So the way we are peeling, how much we are peeling, that is what is important, whether it is the identification of second membrane or the first vitreous membrane itself. So don't try to over exert the pull. Once you know we are over exerting, then you can go and shift instruments from, maybe if you're not comfortable with the cutter, you can have a peeler along with you, or if you're not comfortable with peeler, then try to do forceps peeling as well in couple of situations. I'm just going to rush through my talk because we already discussed all these points. So this is a thing here where we are using only cutter as a main tool here. The illumination port has to be very steady so that it gives you a good illumination throughout your surgical process. And just by the control of cutter, suction, and the interplay between these two instruments, with one instrument itself you can finish off this membrane peeling, and this is a real time unedited video. In 2-3 minutes time you can get away with a carpet rolling technique with with this kind of dense membranes, and don't have to use any other instruments. Just a last tip for my talk is couple of challenging situations where you have so much of contraction happening, and this patient had a massive subretinal bleed as well. So whenever you are using forceps, as Unni rightly pointed out, don't use go at the edge of the detached retina and try to pull it. So whenever there is a use of forceps, try to take out the membranes from the optic nerve head. Basically here we just need a plane for the dissection. So here I am using a forceps right at the edge of the optic nerve head, and then later on, once you have a plane, then you can go with your cutter or a peeler or whichever instrument you want to use, and get rid of the membrane. So these kind of retinas also can be settled down in once you are little meticulous in your dissection, the correct planes, and give good anatomical and functional outcome to your patients. Thank you so very much for a patient hearing, and these are a couple of change cases what we have done in recent past.
Thanks, Manoj. Wonderful. Any questions? Malika, Dr. Abninder, Dr. Unni?
That's okay, sir. The ooze doesn't happen much with newer machines. Obviously. The doing it this way around is like you get a traction from the disc, so that is the only thing. Once you lose the traction, then taking out the membranes becomes little tricky. You can do either ways. Both ways we can do it. No